year, we look at the rising COVID-19 numbers. The question remains, how can we gain a real handle on this pandemic? Are we truly being our brother's keeper? Hello, with this week's feature story, I am Tessa Habed.
Our feature story is brought to you by Belize Camping Experience.
BCE would like to say a big thank you to everyone who's already bought the special package of Country Foods 18 egg trays. By purchasing this package, you support the ministry and work being done around the country of Belize by spreading the gospel to the kids. We are grateful for the partnership of Country Foods who made this promotion possible. If you haven't yet had a chance to be a part of this, there's still time. Go out and grab a tray while supplies last. When you buy these eggs, you are a part of Belize changing Belize.
Thank you for buying these eggs. They support the kids.
BCE. Belize changing Belize.
Over 1 billion people across the globe have been vaccinated against COVID-19. Although this number is large, there are still many people who are hesitant to take the vaccine and still have many questions. The concerns that many have are not only scientific, but there are also ethical concerns in regards to whether or not one should take it. We sat down with Father Michael Rosier, an assistant professor of health management and policy in the College for Public Health and Social Justice at St. Louis University, located in St. Louis, Missouri. Apart from having a medical background, he is also a priest from the Jesuit order and can help us sift through the ethical concerns as well as the scientific.
I am currently an assistant professor of health management and policy in the College for Public Health and Social Justice at St. Louis University in St. Louis, Missouri. My background is in international health systems, in moral theology, and in health policy. I have worked throughout Latin America. I worked for the World Health Organization in Geneva. And a lot of my work has to do with the intersection of healthcare delivery and public health. My training is not as a physician. I am not an MD. I have a PhD in health policy and health management.
Over the past year, Father Michael has had a unique role in terms of relaying information about the virus to the public and gathering research and evidence to support that information.
My role has essentially been constantly looking at all of the information available about all those aspects of the virus and helping decide where is the best evidence, and then how do we provide thoughtful recommendations to the public about how to respond to the virus, whether it be in terms of how we can best prevent it, how we can best treat it, and now, of course, related to vaccinations.
One of the major concerns that has been expressed by the public is that the vaccine was developed with incredible speed, as the vaccine was developed in less than a year after the first case of the virus was reported. It is recommended that anyone who has concerns about the science of the virus should talk to a physician to get an individualized opinion, especially if you have particular health conditions that can be concerning. However, the speed with which the vaccine was developed is not something to be too concerned with, as the factors that usually prolong the development of a vaccine, like financial investment, were eliminated for this particular vaccine.
Even though we have developed the vaccine what seems very quickly, in less than a year, the technology that we've had regarding vaccines has been around for, the mRNA has been around for over a decade. The other ones have been around for decades or centuries. And so really what it's been is reducing a lot of the regulations and other financial concerns that extend the time period for vaccine development. One of the reasons why this vaccine was developed so quickly is because pharmaceutical companies are reluctant to invest in new vaccines until they know it's going to be purchased by people. And so they take years to make sure that they have everything in line. Well, here we took the financial concern away. major countries around the world said, we will buy whatever you produce, so don't worry about the financial concern with it, just get the science of it right. And so it freed up the pharmaceutical companies to really focus on the science rather than the finances. So it has seemed fast for sure, but I personally am not concerned about the speed with which it has occurred. Myself, all of my family and friends, I've encouraged everyone to get vaccinated, and I feel really confident in that decision.
To determine whether or not you should take the vaccine, you can consider the scientific evidence for why this vaccine is effective and why it contributes to making the world safer, and also the ethical considerations. Scientifically, the vaccines are proven to be decreasing the likelihood of contracting the virus and in reducing the likelihood of being hospitalized or dying of COVID.
These vaccines are incredibly effective. So they reduce your likelihood of being infected by 80%. And they reduce your likelihood of being hospitalized or dying from COVID nearly 100%. Nothing is ever 100% in life, but this is as close as it really comes. And so from a scientific point of view, we have shown now we've administered over 1 billion shots around the world, and we're seeing effectiveness. So if we can look at the country of Israel, which has the highest vaccination coverage in the globe right now, and the number of COVID cases that they have experienced has plummeted. And they've had 0 deaths for the last couple of days for the first time since the pandemic arrived. It's amazing scientifically what it does to protect each of us who get vaccinated, but then also it protects us from transmitting the virus to other people.
In terms of morality, one way we can contribute to building a better society and to ensure that people can live as fruitfully as possible is by protecting ourselves and those around us by getting vaccinated against the deadly virus that has been tormenting our world for over a year. It is important to note that in this situation, choosing not to act is actually an action, and choosing not to take the vaccine is also an ethical choice we are making.
We all are looking for ways to contribute to building up a better society, to ensure that people can live as fruitfully as possible. And this is one way that we can do it. I think it's important to note that inaction is actually action in this situation. So choosing not to act isn't as if you are not making a moral choice. When you have something available to you and you choose not to take it, that is also an ethical choice that we are making. And so we have to balance the idea of it's not just the taking of the vaccine or the receiving of the vaccine that I think helps us personally and helps our communities. But if we choose not to do it for whatever reason, and sometimes there might be, after consulting with a physician, a good medical reason not to. The thing about vaccines is that it doesn't just protect us, it helps create a community that's protected. And so what we're trying to do is we're trying to give the virus as few places to go as possible. And that is the thing that eventually eliminates the virus from circulating in our communities. And so if I'm vaccinated, I'm essentially preventing that virus from being able to not just come and infect me, but then move through me to another person.
Another concern is about the AstraZeneca vaccine, which is the one that is available in Belize right now. Blood clots have been reported as a result of receiving the vaccine, and many are hesitant to take it because of that reason. However, the blood clots in relation to the vaccine is incredibly rare compared to the chance of developing blood clots as a result of contracting the virus.
There have been some concerns about blood clots that have arisen as part of AstraZeneca, and any medical procedure does have some kind of risk associated with it. The thing about the blood clots is that it is incredibly infrequent. And actually, blood clots, if you get infected with COVID, are much more likely to occur than from the vaccine. And so if you had to choose between getting COVID, you're going to have a much higher likelihood of getting deadly blood clots from that than from the vaccine. And let's say the entire population of Belize was vaccinated, every last man, woman, and child, statistically, we would expect between 2 and 3 people across the entire country to develop blood clots as a result of the vaccine, which isn't nothing, but it's an incredibly small number compared to the number of people who would have serious medical complications if they were infected with COVID.
A major ethical question regarding the vaccine among Catholics is that the AstraZeneca vaccine has been derived from tissue from aborted fetuses. Would we be guilty of condoning the incredible moral evil that is abortion if we were to take the vaccine?
There is, of course, the question of the connection between the COVID vaccine and any kind of connection with abortion, with tissues or stem cells. And this is a question that we face in medical science all the time, because a lot of the other vaccines that we use, whether it be for chicken pox or rubella, shingles, all of those vaccines were actually connected to these same stem cell lines that came from the 1970s. And so specifically the AstraZeneca vaccine, they were used for kind of stimulating growth initially. There is absolutely no tissue or cells from aborted fetuses in the vaccines themselves. The Pfizer vaccine was tested against some of these lines. So the question, that was asked of the Vatican, actually the Congregation for the Doctrine of the Faith, is this morally permissible? And the response that came back regarding the COVID vaccine is the same thing that came back regarding all the other vaccines. And yes, it is absolutely morally permissible. The remoteness of when that very terrible act was done and the proximity to the life-saving measures that are available now not only make it morally permissible, but morally laudable to take the COVID vaccine, even though there's this incredibly distant connection. So it is certainly part of conversation among the Catholic community, and it's not to kind of dismiss the connection out of hand, but it is to always balance the good that can be achieved with the challenges that have historically occurred. Now, of course, it wouldn't permit us to use a drug that is merely for cosmetic surgery or something like that. But because the good that can be achieved there isn't adequate to override the concerns, but the good that can be achieved through the life-saving measures of the COVID vaccine actually make it quite morally permissible to use this and all the other vaccines that have been connected to this stem cell line from the 1970s.
Given these imperatives and given the promising research thus far, no Catholic should feel anything but relieved to receive a vaccine when it is available, which is exactly what our brothers and sisters at St. Francis Xavier in Corozal and La Immaculada Parish in Orange Walk are feeling right now. Taking advantage of the availability of the vaccine against coronavirus in their community, the entire staff at St. Francis Xavier Parish and at La Immaculada Parish have been vaccinated.
We're encouraging others to get vaccine, especially our parishioners. Here in Orange Walk at La Immaculada Parish, we have all been vaccinated. We are working with the team of the medical professionals in helping our communities to promote the vaccine. We are assisting the team directly with the organizing of special committees who are in charge of ensuring that our parishioners and others who can take the vaccine come out and take advantage of this opportunity. We saw the need of us being safe and having our parishioners safe. We want to go back to a normal life. We want to have our church congregation to be happy, to be, it has been sad seeing the limited amount of parishioners coming to our services. I personally In my family, I experienced death due to COVID too, and that's one of the reasons why I think it was necessary for me to be a part of this team who is promoting the vaccine. We want to eliminate more deaths. We want to encourage people to be safe. Your experience with the COVID-19 vaccine, did it hurt?
Well, not hard. I just feel a little pinch, and I would say nothing else. They should come out to protect their loved ones from pain, from loss of life. They should come out and also continue to practice social distancing, and love of neighbor, love of family member. I encourage them to please come out. The end value is great. They treat you very well. They give you information you need, and I think it's very helpful.
I think they should not be considering it, but make up their mind to take the vaccine. It is for their own benefit. It's for their good future with the vaccine. More protection for their health and their well-being. So I advise our Intrakeños to take the vaccine for their own good.
It didn't hurt that much. It was just a little pinch, that's all. After all, there's some injections that actually hurt more. For me, it was good. It didn't take much time, and they gave us good service. My advice is that you better get vaccinated. It is for the good of our people, the good of each one of us who are aware that sometimes we leave our homes and we do not know who we get in contact with and all that. So for me, it's better to get the vaccine to be more on the safe side.
Yo puedo hablar por mí. Yo la recibí.
I can speak for myself. I received it the same as all the staff last Monday, and I had many doubts because in the last few weeks there has been quite a stir with this AstraZeneca and Johnson & Johnson vaccine. So I had more doubts than fears. But I said to myself, this is what was offered. So what motivated me was, at this point, I was thinking about what I experienced in the critical months of the pandemic in Mexico. Not being able to hug my family, my grandmother. I have my grandmother, who is the only one I have left, so she is already a vulnerable person. So one of the motivations, apart from me saying, and I maintain, was that everyone has an individual responsibility, but also if we see it in a moral point, it would be a social sin on my part not to get the vaccine. But that is already the criterion of each person and the discernment of each person. But it is honestly individual, and I chose to put the dose of AstraZeneca.
There is a lot to say concerning the vaccine, concerning the process of the vaccination that is happening. In Belize, it's more the doubts that arise from our brothers, from our faithful, sometimes in any place. Personally, I decided to get vaccinated. I chose to be vaccinated for the love of life. I think that it is more because of fear. Fear is what impedes. The fear, a lot of people have the fear about what will happen, the side effect they will have, will I die, will I not die, the genetics. How many doubts are there in a person? Including there are persons that don't see it adequate because of the process that took place to develop the vaccines. Personally, I believe that more than the fear, love for life has to be stronger. We are called to love life as a gift of God. Life that is a gift from God. Personally, that's why I decided to get vaccinated, because I love my life and I also love the life of others. If I take care of myself, I am also taking care of others. I don't want to infect others too, given that a lot of persons come closer to us, to those whom we serve. And truly, I won't lie, when all of this vaccination began, well, as human beings, we like to first investigate what will happen after. And at the beginning, well, I also thought about it. What will happen? What will be the side effects? But even so, as I've said before, that I need to vaccinate myself. In my parish, in the Orange Oak district, there are a lot of people that have already received the vaccine. But even so, there are a lot of people that don't want to be vaccinated. Why? Because of fear, because of doubt, because they say that I have faith and God takes care of me. However, this is not a question of faith. I also have faith as a priest. But likewise, I place myself in the middle of the street and a car would knock me down. This is not a question of faith. God gives us His grace. He gives His part. God gave you His part. He has given us the intelligence, a will, and reasoning. And that's what we need to ask for us to take care of ourselves. That is why this is not a question of faith. Clearly, God, there is faith in God. But we also as human beings, we need to give our part.
The evidence is clear. The benefits of taking the vaccine outweigh the concerns, and as Christians, we should strive to be our brother's keeper and put public health above all else. The decision is ultimately one for each individual to make, and everyone should do proper research before making a decision. If you have any concerns regarding your health, make sure you talk to a physician first. Hopefully, this information has answered your questions and has offered some assurance regarding the safety and morality of taking the COVID-19 vaccine. And that's our feature story. Thanks for watching.
For this and more feature stories, you can follow us on Facebook, subscribe to our YouTube channel, or view on Guadalupe Media Channel 96 on CCV or Channel 64 on CBC. You can also tune in on the radio in your car, home, or office at 101.9 FM, and please be sure to download the Guadalupe Media radio app from Google Play or the App Store. Our Blessed Mother, lead us to Jesus.